Hello everyone! It is now time for my 10th shot of testosterone. And I figured for the 10th and final video of this series that I planned, I'm just going to do a rundown of all the different effects that I've felt during this time. Remember, alcohol swab. The first effect that I have felt was inability to sleep. And it wasn't that I needed sleep. I think part of sleep is actually replacing the testosterone in your blood. If you've already got it there, your body just kind of says, well, you don't need sleep. So you go from sleeping 10 hours a day to 5 or 6. You know, when you're a low T patient and you get corrected, all of a sudden you realize, wow, everybody else isn't sleeping as much as me. Now I'm cleaning the end of the vial right here. And I'm also going to prep the site. I'm going to prep it twice again. And last time, for shot number 9, the 9th shot I gave myself, I had an infection around my injection site. And I shared that information with a few of my friends. Opening the sterile bag. Make sure the needle's tight. Pull off the head. Put on the vial. Well, I had redness, soreness, and a patch around the size of a I'd say half a softball, and it was kind of scary for it was on the third day when it was the largest amount of redness, and I almost went to the hospital, but the infection just kind of went down on its own. So when I was picking up another prescription from the VA, I saw my nurse and I showed her my inflammation, and she thought not much of it. So it wasn't life-threatening, but I don't know what it was about shot number 9 that I did wrong, except for maybe I hit a little capillary and didn't have all of the testosterone in the belly fat. You know, and my nurse says that many people like to give themselves this injection in this place right above the thigh. There was a medical word for it, but I forget. Anyways, after 8 times of nothing going wrong, having that infection on the ninth time was kind of a setback. I wasn't very happy about it. You know, mostly because I'm making this series and I'm trying to be, upfront with you guys. All the way out to the 1. Take out the needle. Nobody likes bubbles in their body. There we go. You can see the little drip there. Now, pinch an inch of fat. Sterilize the heck out of it so that the same thing doesn't happen twice. I'm going to just keep sterilizing for the next few shots. I'm probably going to over sterilize, but how more sterile than sterile can you be? Now, pinch an inch, needle goes straight down. Okay. So other than the inability to sleep as much as I have before, which isn't exactly a bad thing unless you're kind of trying to change your sleep schedule because you need to wake up early for something and then you can't sleep before it because you're not sleepy yet, and then you stay up all night. Not a drop of blood. Yay. Boop. Yeah, it's to me it was both a good indication and a bad indication. So on just the positive, not anything wrong with this. I've gotten some muscle strength back. In fact, today I carried a dresser. Now I took the drawers out, okay, but I carried a dresser from my truck through the front door, upstairs, and then brought it downstairs and put it in a room. And yeah, I took the drawers out, but I still have, you know, lazy smarts, I guess, you know. But I think before I had this treatment, just things like that, moving furniture, were things that I just couldn't even muster up the will to do, you know. So it's not just about having the muscle strength to do simple things like that. It's about having the will to do it because it looks like such a daunting task when you have low T. So since this is the recap, I'm going to say once again, I've got a recycled detergent bottle that I'm using for my Sharps container because somebody gave me that idea on one of these videos in the series. Also, I guess I just recently had a haircut, but you guys can see for yourselves like the change in facial fat, I guess. And just click on every video in the series to see that. But I'm going to tell you that I don't think I've lost more than 3 pounds over the 20 weeks that this series has gone, mostly because part of this has been a toning effect. Like muscle weighs more than fat. I think part of the reason why I got an infection by giving myself a stomach fat injection on my 9th shot was because I've been losing belly fat. So I might switch to giving myself the shot below the waist, which doesn't really make for good YouTube videos because I'll get flagged. But yeah, there has been a change in my body composition, and it's been noticeable to me. But mostly the core strength of being able to do things and not remembering the last thing that I tried to do and thinking, well, I didn't have the strength for that, so why am I going to have the strength for that? You know? That's been a very big change for me. And I've made 10 of these videos. You can go down the comment section and see how many people have been disrespectful or trolling. Not many, you know, and that was a big reason why I decided to make this series, is because it's not really an embarrassing thing. You know, you shouldn't be so embarrassed that you don't get help. Many people have low T for many different reasons. Some people, this is true story here, my friend Troy, who was the drummer for a band called Road Rage, he actually was missing a testicle, and that was what was causing his low T, and he was missing his testicle because his day job was that he was a carpenter, and he had an accident with a circular saw, and he had the scars to prove it. It was nasty. But you know, does that make you less of a man if you survive a circular saw accident that like leaves you with this big scar on your belly? No, that's a manly scar. Sometimes it isn't even about your balls. It could be the chemical signals being sent from your pituitary and your pineal and all that. You know, it it doesn't even have to be something that is derived from your testicles. If you believe your manhood is something that resides in your testicles, which you know, why do we equate that? Big balls equals manly. Personally, my reason for having a low T condition was my entire hormonal axis was thrown off by years of not having a thyroid gland and medicating with Synthroid, which it brought my thyroid hormones into regulation, but threw off the rest of my hormonal axis. There's a few different things that interact in your body, and going to chemical synthetic stuff to fix one sometimes messes up another. It's that old adage of I take this pill for my headaches, but it causes diarrhea. I take this pill for my diarrhea, but it gives me cramps, and I take this pill for cramps, and so on. Basically, you have to find a way to use the least amount of substances possible and still get to normal. And if you're not feeling good about yourself, if you are affected in your life, you need to go get help for it. Find out what the reason is. It could be not a chemical reason. You could have some things that you need to talk about with someone, but there are symptoms for low T that you can look up yourself. I believe it's isitlowt.com, and many others that just give a list of symptoms, and if you have them, get checked out. I'd say that even the symptom of depression was something that I had, but it's one of those things where I even have a degree where one of my majors is psychology, and it's something where you can't tell the forest from the trees, because you are yourself, you're not the best judge of whether or not you are depressed. And I've had plenty of people tell me that I am exhibiting a lot more energy lately, and I look a lot happier, and I'm using that for my own diagnosis of myself rather than my own opinion. Talk to your friends, talk to your family, and ask them if they think that you are normally depressed. Talk to people that you barely know as well, because there's a reason why in psychology, in that practice, you're not supposed to see clients that are your family members that you're close to. You're supposed to give them to somebody who can see them from afar and really not be biased by knowing them for a long time. So yeah, I hope you all learned a lot from this series. There's nothing to be ashamed of, and this is a problem that a lot of men have, and they don't seek treatment for. And I hope that if you have this problem, or you think you do, you go get checked out and see what solutions your doctor will prescribe for you. So, you can still leave questions in the description. I will still answer them. I will still answer questions for as long as this series stays up on YouTube, and I may make a recap, say 6 months or a year from now, just to let everybody know how the treatment goes, after that period of time, and maybe recap all the questions that I get in that amount of time. So, take care, everyone, and do whatever makes you feel good. All right? Later.